Hello, everyone. Good evening. This is Dr. Meera Kumar along with Dr. Sumi Pradake. We are here to introduce our Part 3 group. And this is an introduction class which is going to cover about what we are intending to do in our group and how a candidate needs to prepare for Part 3 MRCOG examinations. We are delighted to announce this, and here we go. So, for an ideal candidate who is planning to prepare for the Part 3 MRCOG examinations, usually the questions are going to be how long do I need to prepare? How many hours do I need to give for the preparation? And how many months I need to give the time for my preparation before I plan to sit for the exam? These are common questions. So, suggested approach is do not prepare for more than 3 to 4 months as such. This is not something where like a part 2 examination where you need to keep preparing for quite some time before you understand and remember each and every tidbit points mentioned in the GTG and RCOG guidelines and the TOG articles. This is not so. This is based on your preparation and how you take forward a consultation or take forward a discussion with a colleague or do a teaching session with your colleagues, which is entirely dependent on how you take it forward for some period of time. So if you do it for a long time, say you had been preparing for more than 6 months or so, the vigor gets lost, and this is not a very ideal approach for your part 3 examinations. So once you finish off this part 2, if you plan to sit for that part 3 examination, finish it off within 4 to 6 months time. Suppose if you had the Jan exams which got yourself cleared for part 2, May will be the best time for you to sit for the part 3 exam. If that is not your time, if the situation is such that you cannot sit for the May exam, make sure you are able to give time for the November exam, and not more than this November. You should be waiting. All right, you would need to be finishing it off within 4 to 6 months of your time from part 2 preparation. Otherwise, what happens is the volatile things which you had in your part 2 examination that goes off, and self doubt sets in, and it's very difficult. Candidates find it difficult to get back on the saddle, and this self confidence drops. So that is generally the suggestion where you need to give for 4 to 6 months before you start. So for an ideal candidate who is working, for a day you need to sit for about 3 hours. It need not be continuous, but solid 3 hours is a must for a serious candidate. So how do you allocate the time? People used to prepare hours and hours of notes, and with the advent of AI these days, what happens is they start creating the whole transcript, whatever the candidate needs to say, whatever the role player needs to say, and they just cram it up verbatim. Please do not do that. Please do not do that. This needs to be natural. You need to take in the human cues which the role player is going to give you. So do not take up a lot of time for preparing your notes, and do not take up a lot of time to go over the GTG. It just needs to be for a 15-minute time period for a given task. And the notes which you need to prepare needs to be micro notes, not long drawn sentences. This needs to be just whatever you need to say. For example, if you need to introduce, you should not be writing the whole words, whatever you are going to say to the patient, introduce yourself. It should be just introduction. And the practice needs to be by yourself. You need to practice saying out loud to your study buddy or to your mentor. All right. And the communication practice is what is a must. Be it a simulated patient task, be it a structured discussion task or a teaching station. This needs to be the most important practice which you need to give for a given day. Okay. And that needs to be with the study buddy. So, and one more thing is, before going on to whatever is there in the curriculum, whatever you need to prepare, usual doubt is how the assessment is done, where I can sit for the exam, where shall I go for my exam. Because most of the candidates which we are targeting are Indians. We are trying to concentrate the Indian candidates. Usually the question is, shall I go overseas? Shall I have to go to Malaysia? Shall I have to go to UAE to get a pass? So that is the usual doubt. My suggestion, our suggestion would be, it doesn't matter. It doesn't matter where you are going to go. Your preparation is what is going to matter. We are going to concentrate on how you prepare as a candidate, because the domains which are going to be assessed and the way in which the assessment is done, it is very structured. There are 14 stations, and each station has 12 minutes, which constitutes your 2 minutes reading time. And each of these stations are going to be assessed by trained examiners who are given training on how to assess. And that training and that assessment is based on standardized marking domains. The domains, and the scoring is very much standardized within amidst the assessors. All right, the mark sheets are structured, and the rating is what is called the global rating, and overall the marking will be added up for a given candidate, which is going to be constituting whether a candidate is passing or failing. Don't go deep into this. Don't give time for trying to understand or asking about how an assessment is done and how the assessment is done in different centers. Don't go into that, because irrespective of the centers, irrespective of the difference in circuits for a given day or on a different day, irrespective of the difficulty level, this candidate, if the candidate is supposed to pass, that candidate will be passing. All right, because it is not about the difficulty level, it is not about the difference in the stations or difference in the centers, it is about their performance and their performance only. All right. So make sure you are a strong candidate and do not waste time on trying to understand how an assessment is being done. So in exam structure, you know that this is conducted in multiple circuits per day, morning and afternoon session according to the UK time. So in India, if you're taking up this, will start in the afternoon and will go into the late evening. Generally, on the same day, the circuits are going to be the same. If two circuits are there, two different stations will be given, and for a given day for that circuit, the stations will not change, but it might change accordingly if the days are different. Like day one, different stations will be there, and day two, different stations will be there. Usually, the stations don't repeat on subsequent days. And assessment is designed to ensure that there is no candidate disadvantage. The station format, it is based on simulated patient tasks or structured discussions with the examiner. You also know you have the labor ward stations and the gynae board stations, which could be preoperative or postoperative ward rounds. And examiner usually remains passive in structured discussion stations and teaching stations. The examiner remains passive during the simulated role player tasks and in structured discussion. Sometimes the examiner will be asking you one single question and then waiting for you to go over, or they will be interrupting you with several questions and prompts, and accordingly you will be awarded marks. So, just like I mentioned previously, how the standardization is done, they say that this is statistically adjusted based on the station difficulty, the examiner variation, and the differences in circuits. And hence, because of this reason, it is fair across the countries. I know several mentors used to mention that this is an unfair exam, this is not fair. I wouldn't say so, because it's the same for all. It's the same for all the candidates who are going to appear for that particular exam. So the difference in the fairness, it applies to all, right? So it's not very different from that of our everyday day-to-day life. Some will be disadvantaged, some will have advantage. So the same thing happens in the exam also. So it is better to take it as it is and not go too much into why this is like this. I want to change it. It's not our job or prerogative, or do not waste time even talking about it. Just go forward with your preparation, and if we are there to help you with your daily preparation. So what is the key to the preparation? And some people will be practicing, will be busy practitioners. You might be having wards duties, you might be taking up night duties, you might be in labor ward. So my suggestion would be, if you're able to give time, please give time of 2 to 3 hours per day. If you're not able to give time for a continuous period of time, make sure you at least give 1 to 2 hours. It could be broken up whenever you are free for that particular day. If not, please make sure you cover it up when you are on your off duty times. And continuing with the work will help you in terms of reacting to the different cues that are going to be given to you during your exams, and the way in which you approach a simulated role player for a given disease or a complaint. You will be natural in attending to whatever query they are raising, and as a clinician you will be more confident in conversing with a colleague in structured discussion tasks. So continuing to work is very good when you are taking up the part 3 exams, because in part 2 you need to give a lot of time for preparation, because there is a lot of theory, and you would have had to take off time from time. But it's ideal for the part 3 for a given candidate to continue working for this particular reason. This is just the way in which you are going to be there as a clinician. So continue your clinical work. And make sure you think like an examiner. For a patient, for every patient, that is for every role player or scenario or a labor board case or a pre-op rounds or a scenario is given to you and you're asked to discuss for a structured discussion, assess yourselves under various domains. Think in terms of domain. It doesn't mean you take time off and think what are the things to be mentioned in information gathering. It's not so. When you're preparing for a task, for that particular task, what might be the important points in information gathering I need to prepare? So during the preparatory phase, you need to think like domain wise. But when you are given a task to perform, just during your mark or your exams, at the time you need to react in a natural way. So your preparation domain wise is going to help you when you are appearing for the exam. So right now during the preparatory phase, think of the various domains which you need to apply for a given task. All right. And applied clinical knowledge is something usually good candidates like who scored very well in part 2, they try to showcase their knowledge of part 2 by giving out a lot of information in the applied aspect. They will bombard the patient with so much of information, or put up the structured discussion information so much that the examiner is making you to move on to the next question. So don't overdo the applied clinical knowledge aspect. Just the essential part you need to highlight. And seek regular feedbacks. That is one of the most important things. Self preparation is not of much value in part 3. You need a structured assessment and structured way in which this has to be taken forward, which we will be able to help you in your daily practice. So seek regular feedback and make sure you incorporate the feedback into your practice. Because I had been mentoring for about 3 years, 3 to 4 years now, and I have seen candidates who have taken up the feedback points, both positive and negative, who incorporate, are able to pass in one go. who are able to find it difficult or who are too sensitive, and sometimes they will be offended. I have seen candidates who get offended when we give a negative feedback. That personally I feel is not a growth mentality. I can be harsh sometimes, but doesn't mean I undervalue you or demotivate you. It's just that for a particular thing at that point of time, if there is a better way to do it, I want you to do it. So go forward with the growth mentality and take the feedback in the right stride. That is my humble request. And the essentials to know for a given task would be to understand the basics, the nice pathways, the GTG, and the consent principles you all would have learned in your part 2. So just that you just brush it up in your memory. Do not give time more than 10 to 15 minutes for this preparation. And your preparation strategy needs to be in a structured course. There are a lot of free groups available, and the best way to do it is get a structured group which helps you as a candidate, and not which is one which is very flashy, or which is costing you a lot, or giving you very positive feedbacks which doesn't see you grow as a candidate. Don't waste time there. See which platform fits you best, stick to it, take the feedbacks, and go forward and crack it in one go. And do a frequent task based drills. Once you finish a module, try to take up a drill either with your study buddy or with your mentor, so that you are continuing to have a grip on that particular module. So the additional skills which you need to have are the teaching skills, because a good clinician is always a good teacher. So for us as clinicians, we should always continue to have a good teaching skill. So those who are practicing, those who are clinicians, brush up on your teaching skills, and talk with successful candidates, how their experiences were, where they found difficulty, how they were able to crack it. So get into their mode of how they saw the preparation, how they saw the exams, and take that into your mind. So with that, I will wind up, and over to Dr. Sumi for the further detailed discussion about how to go forward with the preparation. Thank you so much for patient listening.
So, hello everyone. Hello everyone. I'm Dr. Sumi Padarthi, and here I am, one of the mentors for Part 3 Summit MRCOG. And I will be discussing with you today about what the core curriculum of RCOG for Part 3 is all about. So now all of you have passed Part 2, and you're really very good with the clinical knowledge. And so then, what is the necessity for the Part 3? Why should we, take up a an exam like Part 3 once, since we have proved that we are really good clinicians? So here is where the RCOG makes a lot of difference from all the other practical exams comparing to this MRCOG Part 3 exam. So what is it that is different here? So we can see this all this I have taken from the core curriculum, that is the syllabus that RCOG has suggested for us for Part 3. And here we can see that we can go to the next enter. So here we see that RCOG has divided the entire necessity, that is what we need to know for Part 3, into something that we call the 14 CIPs, or the capabilities in practice. We don't have to go very much deep into this because it's really confusing. So what I would like to tell you is that here I will be discussing with you what is different, what are the additional skills we need to know apart from our Part 2 training. So this they have divided into two things, which we call the generic and the specialty specific. So specialty specific is what we already know, our obstetrics, gynecology, emergency obstetrics, emergency gynecology, all this comes here. We can go to the previous one. So that is the specialty specific, the previous one. And the generic one is what we are going to concentrate upon. These are the skills that we need to develop. And there is another important difference that the RCOG has made. That is that is entire MRCOG training. It has to move away from a disease-based approach to a person-centered approach. So the next one. Here, these are the 14 CIPs, that is the capabilities in practice. So this part is the specialty specific one, which we are really very good at. And all of us, since we have passed Part 2, we have proved that we are really good clinicians. And the other part is the generic, or the Part 3 communication based approach. So this first we'll look into the disease centered approach. You can keep clicking. So there are a lot of skills that we need to know. That is, so this is the obstetrics part, gynecology part, managing emergency obstetrics, emergency gynecology. All this we are really good at, and even anytime we will be able to answer them. So this part we do not have to concentrate much for the Part 3 preparation. So next one. And this is another part, which is the champion for women's health. Here, we need to concentrate upon individuals' social well-being, the mental health issues, promoting a healthy lifestyle, illness prevention, and a non-discriminatory practice. So, what is the healthy lifestyle? BMI, PCOS, we can address all that, and smoking, alcohol needs to be addressed. So, this we do this in our day-to-day practice as well. So, this we can have a small brush up to become better in these clinical skills. And the next one, and this is the most important part, which is the patient-centered approach. Next one. I have condensed all the the tabular columns of the RCOG. If you would like to go through, you can go through all this, and I have highlighted the important points as well. And the next slide. Here I have made a summary of all the important clinical skills, that is communication skills, that we need to know from a patient-centered approach for the RCOG exam. And I can tell you, if we change our approach even in our daily practice, inculcating all these all these skills, we will become really good clinician. We can always stand apart, and hence that is the that is the idea of RCOG. And I hope all of us will also inculcate this in our daily practice as well. So this communication skills can be divided into different topics, such as the communication, professionalism, reflection, clinical skills, and core values. Some of them we are already we have good knowledge about after part two, such as the reflection, that is debriefing, giving them support and all that, and also audit, clinical governance. This part we are very well versed with. And here we will, in part three preparation, we'll learn how to incorporate all these skills into the communication. And others, the communication skills, such as we need to listen to the patient and adapt according to the patient. If the patient is angry, adapt according to that. If the patient is sad and having a bad news, then according to that we need to adapt. Then taking a consent for any procedure, even looking into the patient's notes, we need to take their consent. And negotiation. So what is negotiation? Suppose we feel that the patient needs a specific treatment, but they do not want it. For example, the patient is asking for a home delivery, but it's a very high risk pregnancy. Then our negotiation skills should come into practice in order to help the patient to have a tertiary care delivery. And next is the core values, that is empathy, respect, compassion, and non-judgmental attitude. This is a very important part, and to develop the skills. So here, empathy is when a patient is sad, we need to address their feelings, such as, I can see how difficult it must be for you. And if the patient respect, compassion, and non-judgment, what is this non-judgmental attitude? That is, if for example you are addressing a BMI, then we need to be very sensitive in addressing the person in such a way that their feelings are not getting hurt. And the last one is the clinical skills. That is, these skills are very much the RCOG sees these skills during our labor ward prioritization, gynae ward prioritization. It assesses all these skills, such as prioritization, leadership skills, and whether we put patient safety first, and whether we have a situational awareness. So we will be using all these skills, inculcating all these skills in our further task practice, and we'll make sure that all of these skills are developed. And so we have come to the end of this discussion.
Thank you very much, Dr. Sumi. That was very enlightening. I think for the candidates, they will find it helpful. So today's session, we just saw about the introduction, how to prepare for part 3, and what constitutes the core curriculum in detail. So we would like to urge you that continue with the daily practice, and as we delve into the further sessions, make sure you are available for the free sessions to make the most of it. And any particular tasks or any doubts or anything you would need clarity, please let us know, so that we'll be able to help you. For any queries, please contact any of us. We are there in the group for you 24/7. Thank you very much.
Thank you, Dr. Meera.
Thank you, Dr. Sumi. We shall wind up.